Let's talk about exercise in terms of what are the basic ideas of when you can exercise, what can you do. I always say that any kind of anesthesia, any kind of sedation, you're going to feel a little bit of being tired afterwards. That's normal, no matter what age group you are, what gender you are, no matter how physically fit you are. That tiredness can last a week. It can even be slightly longer. It can even be a few weeks or even a month, but it's pretty uncommon that long a time. So I always say listen to your body. Just when you're going back to your working out, don't rush it. Don't go back and say, you know, I can lift all this weight. I'm going to go ahead and just start pushing it. You want to start gently. And the things that I always do is I would have you, instead of just running on a treadmill, start on a stationary bicycle. That way, if you feel lightheaded, you're ready in a sitting position, you're okay. You want to go about half of what you usually do, both the RPMs as far as the distance, the resistance, everything, and gradually build yourself up. If you like walking on a treadmill or running on a treadmill, you want to start with that stationary bike. Make sure you're not getting dizzy from that. If you feel comfortable with that, and you can go back and start doing a light walking on a treadmill, and the light walking can then start getting to a faster paced walk, etc. I really don't want you to be jogging for most of my procedures for the first 14 days. You can go back and do some light walking and things like that. It's okay. In terms of lifting weights, fat grafting, rhinoplasty, things like that, unless you're not going to bang something, you could lift some light weights. Facelifts, I don't want a lot of exertion in the lower face, so that's something I'd be more cautious in terms of lifting. And the key with this, especially otoplasties, rhinoplasty, things where I've done some delicate work, I don't want someone to bang your face. Fat grafting, you're going to be relatively okay. You're not going to reposition my fat. But with otoplasties, rhinoplasties, even facelifts, I'd be a little bit cautious in terms of anything. You know, if you're lifting weights, I don't want someone to come and bang it or anything like that. So just listen to your body, gradually build yourself back up there. If there's any questions about your workout regimen, please just call me, ask me. Let's go over this together, because everything is individualized for you. These are just general guidelines that I have for you that I usually repeat to most of my patients. Hopefully this video will help you reinforce some of the concepts that may be important for you following a procedure.